Hello friends, my name is Dr. Jaydeep Walinjkar. I am an ophthalmologist and a senior vitreoretina surgeon. I practice at Aditya Jyot Eye Hospital, which is a unit of Dr. Agarwals Eye Hospital located in central Mumbai at Vadala West, opposite SIWS College. Today I'll be briefing you about a relatively common retinal condition we come across as retina specialists in our clinics, and it is called Central Serous Chorioretinopathy, or commonly known as CSR. So what is special about this condition is that the cause of this condition is not known yet, and it affects men in their early 30s or 40s, and this condition causes sudden blurring of vision. So what kind of people are more predisposed to getting this condition? As I already said, we don't know the cause, but we know that people who have type A personality, who are very anxious, who get stressed easily and are having stress at multiple levels can get this condition at some point of their life, in the 30s or 40s of their life. The second kind of people who get these conditions are people who are on chronic oral or systemic steroid therapy or are using steroids for medical purpose in any way. These people are also prone to getting this condition, and I will brief you what generally happens when this happens. So the most common symptom that the patients come across is a sudden blurring of vision, most commonly in one of their eyes, and that brings them to the eye doctor. So what we see inside the eye is that the central area of the retina, called the macula, which is very important for vision, has gotten lifted up and some fluid has got collected under the macula. So this is a very typical sign of central serous chorioretinopathy, or CSR. When we see these patients in our clinic, we generally do few tests to document this leakage of fluid and the elevation of the retina and fluid collection, and then we generally ask the patient to wait for about a month, because 70% of these patients resolve on their own. They don't need any treatment. However, if there is persistent leakage and fluid under the retina with no improvement in vision after end of 1 month, then we generally go for further investigations where we do an angiography of the retina, where a dye is injected through a vein in the hand and serial photographs of the retina are taken to find out the area of leakage. In case we find out the area of leakage, the next step for treatment is to do a simple retinal laser to the area of leakage to stop it. However, if the leakage is happening in the central 3 millimeters of the retina, we cannot do simple laser. So what is next? Generally, we give more time for observation, as almost another 30 to 40% of these people who have persistent leakage and fluid will resolve on their own over a period of next 2 to 3 months. If that does not happen, then we have to look for other options, like giving some medications which have shown relative efficacy in trying to reduce this leakage and cause the disease to regress. In the initial stages, we also make sure that the patient is not taking steroids medically in any form, and that is very important, as we need to stop them if the patient is using them in any form. The next step is, if the CSR becomes chronic, there is another type of laser treatment called photodynamic therapy, which is a less damaging laser to the retina, which can be done, and that helps to regress the disease in most of the cases. The vision prognosis in this condition is relatively good because most of the people resolve on their own. The only defect they may sometimes perceive is a relative difference in the contrast, the color brightness, the light brightness compared to the normal eye in the affected eye. Otherwise, they can get near normal vision back. Only in the advanced and the chronic cases, the vision can decrease and deteriorate, but still, this disease does not cause legal blindness in most of the patients. So, a condition which can be reversed uh, uh, without any treatment